online a couple of months ago, and I found this fella had posted the billing for a recent admission to the hospital. This poor guy, a young single man working for some tech industry somewhere, gets right upper quadrant pain, and he's got to go to the hospital. And he goes to the ER assesses him, does some lab work, says, we think you got gallstones. They get the ultrasound, a couple other studies, they consult the surgeon comes down, he agrees. Off they go to the operating room, endoscopic surgery, gallbladder removed in about 30 minutes. He overnights it in the hospital, goes home the next day. Miracle of medical care, the endoscopic cholecystectomy. Awesome operation. I mean, the guy's back to work within 3 days of having his gallbladder removed. However, this is his bill, itemized for you, $77,431. And his concluding comment on this blog was that next time, I think I'll see if I die or not, because I'll never get this paid. How does a guy whose income might be, $34,000 pay a $77,000 bill? Not going to happen. I'm going to just ignore this call. It's my ship's bells here.
Or the rain.
Ship's coming in.
Yes, sir. So how does this work? So this bill, this $77,000 bill, if this guy's got health insurance, the bill gets submitted to the insurance company, and a copy is sent to him, to the subscriber, right? He sees this $77,000 bill, just about has a heart attack, and then he thanks God that his employer got him on board with this health plan that costs him, as a single guy, probably about $5,000, $6,000 a year to have, right? And it's just a blessing that he's got this insurance, right? However, what does that insurance company actually do? Well, that hospital part of the bill, that's $75,000 of that, only 9% of that actually gets paid to the hospital. 9%. Okay, this is not a decimal error. Less than 10% on average. Aggregate average payment to the hospital, 9%. The doctors, it averages about 40%. This is, I looked at my billing processes lately. It runs around 40, 41%, somewhere in there. The fact is, however, everybody makes money. All right, the hospital makes money when they get paid 9% of the bill. I'm making money when I get paid 40% of the bill, right? So what's happening is the billing process is actually this fiction that gets generated by a lot of people and submitted to these third-party payers, out of which they pay this percentage. All right? Do you see where that leads the whole discussion? All right. The price that those third-party payers pay is often negotiated in advance, but it's actually more accurate to say that it is dictated in advance. All right? I don't get to tell the major insurance provider in this state what I'm going to get paid for doing a facial reconstruction for skin cancer. I mean, I submit them a bill, but they go, oh, that's interesting. They pay you what they're going to pay you, right? What other industry is there where the buyer dictates the price? Is there injustice in that? Okay. Nobody lowers their prices, however. I mean, we all know that this is a fiction. Nobody lowers their prices because of a peculiarity in the system. How do we get the pricing? Medicare, every year, continuously through the year, monitors hospitals for their cost. They monitor hospitals for what they're spending on everything from the lights to the phones to the bandages to the blood products to everything. And based upon that, they calculate what the costs for particular services are, and above that cost they pay 1%. 1% above cost. This obviously explains why hospitals have gone to a very centralized, large industrial model for economy of scale. Little local hospitals have a very hard time living in that environment. They live in a very short-lived income stream, and if you interrupt it for a couple of months, you've just ruined that hospital, right? That's why hospital systems have grown into these gigantic entities that are constantly being traded, okay? But nobody wants to lower their price. Okay, so you get this Medicare generates this cost structure. The hospitals get paid 1% above that, and then large insurance companies key themselves to what Medicare is paying. They'll negotiate, well, okay, we'll pay you 3% above what Medicare pays, and the hospital system goes, all right, we're cool with that. There are also preferred provider organizations, however, that key themselves to what you bill. So they're the ones who say, all right, we'll pay you X% of what you bill, and to the doctor and to the hospital. So now, not only is the price being dictated, but what I bill is being dictated, because if I lower what I bill, I'm going to get 40% of the lower price. All right? So you see this tension that now exists there that keeps the billed price high, right, while paying no more. So the fiction continues. The fiction continues. By keeping the price high, too, what it does is it keeps everybody paying their premiums on time, right? Because you're constantly being threatened by these ridiculously big bills. All right? You don't get to negotiate. If you go to a hospital and you know, God forbid you have some catastrophe like your car wreck and you have no insurance, you don't go in there and tell them what you're going to pay. You have no negotiation power. You're one solitary individual, and they'll tell you what you're going to pay. And if you say, well, I don't want to pay that, they'll go, well, that's interesting. This is the name of the collection agency that will be calling you. Would you like a payment booklet? That's it. You as an individual, that's what you get. The other thing to remember is that it's those billed prices. It's that fiction price that's used to calculate the cost of health care in America. When you hear a congressman or a senator arguing about the skyrocketing healthcare costs, what's skyrocketing is the size of the lie, not what's actually being spent. That's what's skyrocketing. Okay. Remember, it began with the creation of a federal medical system. This is what started the whole thing. This is the match that lit the whole thing off. And it's propagated by legislation that forces people into the insurance pool. Remember the difference between HMOs, which key their price structure to Medicare, versus PPOs, which key them to the bill that's submitted. And the whole thing is sustained by this propaganda and advertising techniques. Insurance companies lead with the fear of catastrophe, right? They sell you on how completely they will care for you, but they always begin with a presentation of how catastrophic it would be for you if you should have a medical problem. All right. Our system. So what we have here, if you translate our system to Italian, it's called La Cosa Nostra. What you have one agency that threatens you with ruin. You know, the agencies that generate the bill. That's the threat. That's the guy coming into your little corner grocery store and saying, gee, you know, this is a beautiful little business you got here. It'd be a shame to see it burn to the ground. You know? Right? And then you have the other agency that walks in 20 minutes later and say, you know, this is a beautiful business, and I understand you're under a lot of pressure here. A lot of pressure. We can protect you from this. Okay? And just as in that example, the threat is created. My business was not in jeopardy until Guido walked in the door and threatened me. I was doing just fine. Okay. Important to understand that medical bankruptcy today leads job loss as a cause of financial ruin. Medical bankruptcy. You could also talk to General Motors about that when you consider how much of their business evaporated because they had to tack the cost of medical insurance, not only in their active employees, but in their retirement programs, to the cost of every car that rolled out the door. And it drove General Motors out of business, drove them into bankruptcy. And now all of a sudden, somebody owns the grocery store. Somebody owns the grocery store, and it ain't the grocer anymore. It's the guy who created the problem in the first place. Okay. I'm not into criminal conspiracies here. I'm not here with my foil hat on my head to talk to you about conspiracy theories.